Yes, she will introduce.
Okay, so I was trying to work on my cap. You know, you guys didn't see me on this. Yes, but now every 29th day in the month of September, of course, now World Heart Day. When I mean world, I'm saying that it's something we say we celebrate worldwide. Okay, so not just for Nigeria. And because today on every Saturday we always get with Dr. Bat in the building. You know, go carry last on the show, but then we get a very big. You can see Dr. Bat. Dr. Bat, we are colleagues today. I'm not matron. I'm a doctor on set.
Yes,
and of course, we can't get another Palsy. Somebody will be say is specialized in that field. You understand? But guess what? It's Dr. Bat that were allowed to do the introduction as your matron in the studio. Dr. Bat, good
Thank
morning,
you very
sir.
much. You're looking red.
Nah, something nobody know. I had to just come.
Chief, good morning, sir. So nice to be with you.
Good morning,
Chief.
Yeah, GP.
GP
Not
matron.
GP.
He's a GP, general practitioner. I'm the matron.
Okay.
Yeah.
This GP.
He's senior. No,
senior GP. He's a senior matron.
Okay.
Yeah, good morning, viewers at home and around the world. You can see we're all looking red today.
Yeah.
And it's understandably so. Today is World Heart Day. World Heart Day. The theme is My Heart, Your Heart. Okay?
My heart,
now, essentially, when we talk about heart, we talk about the challenges that can occur with the heart. Top on the list is heart attack, stroke. We refer to them as cardiovascular disease. Okay? So with us in the studio today, this morning, is an interventional cardiologist.
Interventional cardiologist.
He is a US-trained interventional cardiologist.
Wow.
Okay? In the person of Dr. Adeyemi Johnson. He is the MD, CEO of First Cardiology Consultants, located in Ikoyi, here in Lagos. May I at this time yield the floor to my Oga Chief. I present Kefalik, sir.
Good morning, sir.
Yes, good morning. Good morning. So you want me to talk about heart disease today?
Yes, sir.
Well, let me first explain what World Heart Day is. It happens every 29th of September every year.
Okay.
It has been set up that way to help us build awareness of heart disease. Many of us are not aware, especially in Nigeria. We used to think we didn't have heart disease. Now, you say I'm US trained, but I was trained here first in Idiaraba, Luth.
Thank you very much.
So that's why I underwent my medical training. And I can tell you, during that time, we saw only one heart attack in my 5 years in medical school. One. And it was a white man. Caucasian, sorry.
I hope he survived, sir.
He did. But all of us, all the medical students, had to come and see him, all 500 of us. That is a heart attack.
Practical.
So we thought it was just a disease of other people, not Nigerians. Okay. But now, heart disease encompasses heart and the brain, which means stroke is one of the things you think about. Heart attacks, one of the things you think about. Cardiac arrest. I know those are the words the people on the street understand. Heart attack, stroke, cardiac arrest. Now, I can tell you 90% of the strokes and heart attacks I see, 90% are preventable. They are preventable if only people were aware of what they should do to make sure these things don't happen. So what do I mean by that? I think all of us know what a stroke is, or have an idea of what a stroke is. When you see somebody suddenly collapse and then they're paralyzed on one side of their body, that is the typical stroke. There are other types of stroke, but that is the typical stroke. Now, number one cause of stroke in Nigeria is high blood pressure. That is number one, blood pressure. And many of them did not know they had high blood pressure before it happened. And then some knew, but didn't take their medications, especially the men. Because there's this side effect of some of the medications which affects your sexual performance. So many men don't take the drugs because
you don't want it to.
Yes, they don't want it to interfere with their social life. But the trouble is, when you do that and you get the stroke, sex is no longer an option. So you need to find a way to sort that out. Now, there are many drugs. There are many drugs. So when you have this problem, if it affects your sexual drive, let your doctor know. Let the doctor know. We will find a combination that will work for you. That is very, very important. That's the number one cause. That's one thing I think we should really talk about, high blood pressure. It is prevalent. 50 to 60% of Nigerians above the age of 40 have high blood pressure. So it is, if we check everybody's blood pressure in this studio now above 40, we'll find one or two. Even this elderly looking one, we'll find one or two. Now, what causes high blood pressure? Part of it is our genetic makeup. When you look at the WHO map of high blood pressure, green is the lowest incidence, dark red is the highest incidence. Nigeria is dark red. It is very dark. We have a lot of high blood pressure. Now, what causes it? One is our genetic makeup. Two is the diet. If there's anything I'm going to talk about today about diet, I'm not going to talk about cholesterol, all those things. It's mainly salt. Now, recommended, I'll give you a gauge to work with. Recommended salt intake is 2 grams of sodium a day. Now, I know none of you can know how many grams you're cooking in your food.
I don't know.
You just pour salt.
Yes.
And before I go into the 2 grams, sea salt, any kind of salt is salt. It's all bad.
Okay.
All right. So people say, oh, mine is sea salt. All these bouillon cubes all have salt. Okay, so recommended salt intake is 2 grams. Now, in England, the average salt intake is about 3 grams, 3 to 4. In the US, about 6 grams. In Nigeria, it's 12. Wow. So that shows you we are taking 6 times more salt than the rest of the world. So salt is one of the main things. So you have to look for hidden areas of salt we don't think about. Potato chips, plantain chips, cashew nuts. Things that we just take for granted, they have a lot of salt.
We don't joke with.
They have a lot of salt. These noodles, the sauce of the noodles, loaded with salt. So things like that. And then bouillon cubes that we used to make stew, it's all salt. So first thing I would say, most important thing, if anybody's listening, is reduce your salt intake. That is number 1. Reduce your salt intake. That will reduce the incidence of strokes. And it has, in UK, they made a law about 10 years ago. So when you go out to eat, restaurants and co cannot add salt to the food. And since then, the incidence of heart attacks and strokes has come down dramatically. So that's number 1 statement for today. Message. Reduce your salt intake.
Very emphatic.
Because some people, maybe in a fashion they things then they do. They go food you don't do, they will still do salt like this, to spice it. Some people in a fashion then they take and do.
So, but you talked about hypertension for, I think you mentioned a particular age, between the ages of 40 and above. But these days, we have people that are within their 30s and are hypertensive. So are we saying there is an increase in that, or what should we say is the major cause of it?
Blood pressure. You even have children with high blood pressure. Wow. All right? So those are special cases. But blood pressure, the highest incidence is once you're above 40. Then all the things in life affect you. Stress, too much liquidity, excess liquidity, too little liquidity, NEPA, no power, traffic, all these things. They now add to your stress and bring up the blood pressure. I think, let me tell you something. Many of my patients who go abroad, who have high blood pressure, when they go abroad, their blood pressure goes down. And then they come off their blood pressure medicine. Their doctor in England says, but you don't have high blood pressure. The minute they hit the airports, the blood pressure goes up.
Does it have to do with our climate, sir?
I don't know what it is, but there's
you don't drop your first face. That will drop where you have to press on and you use on to be singing. Ping, 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 ping. It is part of it. Now, sir, after salt intake, what else do you think could be adduced or
risk factors?
Okay, the other risk factors. High cholesterol is one, but before high cholesterol, I would say diabetes. Okay. There is now an epidemic of diabetes in Nigeria. Yes. All right, there is. And diabetes contributes to stroke and heart attacks. All right, you see all these people dying suddenly, even in the Senate, House of Assembly. It's usually a stroke or heart attack. And diabetes is one of the contributors. Now, why do we have more diabetes than we used to have? It is because we are now getting more obese. All right, like me here, I am considered very overweight if you look at the charts.
But you look very smart and...
I don't understand.
That's for one and it's packaging. All right, but so if you are fatter than me, you are too fat.
Really?
Yes. And the incidence of diabetes goes up with your weight.
Yes.
So now, because Nigerians are Okay, you people are a bit young. In my time, you want to go to school. You first trek to the bus stop, at least half a mile. Then from the bus, you get to the other bus stop. You now trek to your school or your destination. So everybody walked at least 2 miles a day. All right. Now, you will take Okada to exactly where you are going. And if you notice on Okada, you see many people, you don't know how the Okada is carrying them. The thing looks like it's going to burst. But so we are getting too fat. We're not exercising.
Sorry, sir. Before you move on that diabetes, in the normal street thing, we used to think, I think sugar is the only factor that could be traced to diabetes. In fact, that is what I feel many people feel. So when you
No,
now
it's
say
not sugar. Now, no, sugar is part of it. But you'll be surprised what I will explain. Once you are overweight, you put yourself at risk for diabetes. All right. That's why the incidence of diabetes has gone up all over the world. In the US too, you can see there are not small people there. So diabetes has gone up too. Now, once you have diabetes, you want to eat foods that will not make your sugar go up immediately.
Okay.
All right, in your blood system. Now, eating a teaspoon of sugar in your cup of coffee is not really going to harm you. What harms you is rice, dodo,
Yam.
bread, those type of things that you
Cakes,
think,
meat pie.
you know, they make your sugar go up fast. So it does not mean you can't eat rice or dodo, but you should just know when you eat rice, eat little amounts. Ofada rice actually is quite good.
Okay.
like Ofada.
Yeah.
Most especially the pepper and the pomo.
Not,
You see,
the
that's
rice.
a but.
not the designer stew.
That
That one is palm oil.
Okay.
Yes, that's not so good.
It's
But
too
I'm not
much.
going to
Or
tell
when
you
get
not
sick.
to do everything.
I think everything should just be
Today's
in moderation.
message is salt and activity, and take your blood pressure medicines. Now, true, all those things are nice, but they are loaded with the fat that can cause.
But Sapmo doesn't have
cholesterol.
any vitamin.
Asthma.
Momo. Yes.
It doesn't have fat.
It doesn't have anything, any
It,
value.
it doesn't have any much nutritional value, but it has a lot of fat.
Mama,
Yes.
wọ́n ti parọ́ fún wa.
They lied to
They
us.
have lied to us.
They say Momo does not have anything.
Mama, you don't
Just
get
end now.
anything.
Anyways,
Let me draw you back, sir. What's the correlation between diabetes, hypertension, and kidney failure and chronic kidney disease? Because they also seem to be on the rise.
They are triplets. They go together.
together.
They all go together. If you have hypertension and you have diabetes, the things that kill you, using strong language, when you have diabetes and hypertension are stroke, heart attacks, and kidney failure. So when your blood pressure is high, it damages the kidney. But diabetes also damages the kidney. So the key is, the best prevention of diabetes is not to be overweight. What we call adult onset diabetes, type 2 diabetes, is not to be overweight, and is to exercise. And even when you get the diabetes, if you do get diabetes, because it runs in families, if you get diabetes, it is still the same thing. You get less complications when you control your sugar, you exercise, and you eat properly. Diabetes doesn't mean you cannot eat rice, you cannot eat dodo. It just means you have less quantity of that and eat more vegetables.
Our secondary biology, then they always make us realize, say, if person get insulin for body, sugar no go dey in body. So I want to throw this out, sir. Is it normal for somebody to say, I want to take insulin injection so that I no go get diabetes at all? Is it advisable, sir, for one to meet like a GP doctor batch now?
It's only a Babalawo doctor that would do that.
Sorry. Chief, mind yourself.
No. You don't give insulin to prevent diabetes. By the time you give insulin, it means oral medications are not working. And then you need insulin to bring down the sugar. So it is not a good idea to give insulin to prevent diabetes. No. You exercise and you eat healthy. And exercise, you don't have to go and buy a gym or join a club. Just walk 30-40 minutes a day. It's enough. That's all you need. You don't need to go and develop big muscles and everything. Just walk 30-40 minutes a day. Instead of taking the lift to the 3rd floor, walk up. Little things like that, they add to it. Instead of parking right at the door where you're going. Park a little bit away and walk there. You know, but exercise really, really helps.
What's the duration of exercise per day or per week that should be advisable for
I
people?
think 30 to 40 minutes a day will be helpful. But the key is none of us can really calculate how much we do. Most people exercise on weekends. You see them on Lekki Bridge on weekends, but then weekday they don't go. You need at least 4 days of exercise a week for it to be really effective. And it works.
Okay, so I am growing up, you get this belief relating to stroke, say, until when you begin reach 50 and all of that. But now, these days, we they find youth, maybe from 16, they don't really get stroke. So what will be the major factor? Is it still traceable to being hypertensive, or you get any other thing that is attributing to that?
That's a good question. A real matron.
I like that.
When you get somebody with a stroke at 16 and things like that, it's usually not hypertension.
Okay.
There's something other wrong, like an aneurysm in the brain that bursts, that will cause the stroke, or an accident. Stroke just means an accident in the brain. You know, so something has gone wrong, and part of the brain did not get oxygen for a while. Either the vessel burst or a blood clot stops the stroke. So there are many reasons that happen. In the young kids, it's unlikely to be just high blood pressure. Something else probably happened.
Sorry, sir. Quickly, there is something I noticed that is rampant these days, but I don't know. Maybe we should class it as stroke, and I want you to help us demystify on it. There is this sudden, somebody sleeps, he wakes up, and there's a shift there's this funny look that maybe some part of his mouth will shift, and his hands will still function, the leg will function normally. Unlike normal stroke, that there will be a total paralysis of the side. But this time around, just the eyes, the nose, the mouth, it will tell you something is. Sir, can we also call that stroke, or what is it called? And is it curable?
Are you people asking medical questions? So that's a very, very good question.
Thanks to
It's
Dr.
our
Bass.
senior medical.
Thanks to Dr. Bass.
That's 1 year now. We'll be a surgeon.
E-doctors, there will be e-doctors.
Okay,
E-doctors.
Thanks to Dr. Bass.
Internet doctor.
Internet doctor.
Yes, sir.
Okay, that is an interesting question. What you're describing is Bell's palsy.
Bells.
B-E-L-L.
Okay.
Bell's palsy. That's what you're describing, where just part of the face is paralyzed, usually the lips and the eye and all that. Now, sometimes it's difficult to differentiate from a stroke. Okay. So sometimes, but a good physical exam and maybe a CT scan will tell you it's not a stroke, Bell's palsy. It can be reversed in most cases, but in some cases there's permanent damage. But it is just inflammation of one of the nerves to the face that paralyzes that part of the face. Oftentimes it's a viral infection, I think. So we treat with steroids and antiviral medications, and many of them recover, but not all. I myself had it when I was a kid. I remember that very well.
Wow.
I had it when I was a kid, and it was when I went into medical school I realized what it was, because I would be drinking. I remember very well, Sunday. You might not be old enough to know that in those days, Sunday is the day all of us sit down, eat lunch, and get jollof rice.
Like Christmas Day.
Yes. So I was drinking my water, and the thing was dropping down. My father thought I was joking. So he first beat me. I should stop fooling around on the dinner table, that there are guests there and all. So anyway, it lasted for about a week. And then it went away by itself. But it was when I finally got into medical school, I knew what it was. Yeah.
But sir,
I got a beating for it.
Wow.
Wow.
But I think, sir, you are just being lucky, because the one you
He
said,
was just one of the lucky persons.
You are one of the lucky persons, because most times when it happens, there is this fear, and maybe I want you to also sensitize the public. Since it's curable.
No, it's very scary, because you think it's a stroke. You think it's a stroke. When most people rush to the hospital and think it's a stroke. And then you do a good clinical exam, you'll find out it is not a stroke. It's paralysis of one of the nerves. And if you give medications immediately, about 70-80% of them recover. Some will not recover. And 50% will recover without drugs.
For the purpose of our viewers at home, what are the signs that a layman can see and begin to suspect that somebody is having a stroke, sir?
Well, somebody suddenly walking and then falls down, and then they can't get up, and then you notice one side of the body is not moving. That is the easiest recognition. But any loss of consciousness or loss of sight, somebody suddenly can't see, or you start there talking and then their speech gets slurred. Those are the subtle signs of the stroke. And the key thing with stroke is this. Once you suspect it, you need to get to a hospital immediately, because many of them, if we get them on time, within the first 3 hours of the stroke, there's some medications we can give to remove the blood clot that's causing the stroke. So it is critical not to wait. Once you suspect, run straight to a hospital that has the facilities to take care of a stroke. And 60% of the time, we can remove the blood clot that's causing the stroke and prevent the permanent damage. But you've got to be there within 3 hours. Within the earlier we treat, the better the prognosis. So it is critical. Do not. I know we're a religious society, so people will first start praying and things like that.
And the 3 hours must have elapsed before they will
so
start
the key
making
is
their
to
way to the
start
hospital.
the prayer and be moving to the hospital. No harm in praying, but be going to the hospital, because God doesn't always work miracles in the way you expect. Sometimes you say you get to the hospital, you find out everything works out. It's part of God's work, but to just stay and pray only doesn't usually work. Pray and start coming to the hospital.
Okay.
What are the types of stroke? You mentioned clot. Does it all have to do with clot formation?
There are several types of strokes, but the commonest ones are blood clots, and then you bleed into the brain. Because the blood pressure is very high, you burst the blood vessel and then you bleed into the brain, and that causes a stroke.
Okay, I think it's high time we opened the phone line so that those will be out on ourselves go fit enjoy the thing we enjoy, because Dr. Adeyemi na man we really enjoy and well. So feel free, call on the numbers scrolling on the screen, and the doctor will definitely answer you. Okay. Now, sir, Dr. Bat, this thing I remember, I say me and you don't talk on before, but as cardiologists, they make I ask, sir, there's a particular point in time when I felt some pains on this side of the chest, maybe due to my old age and everything. I said, okay, due to this old age. Well, so when I ran a test, they used the one that there's rubber, they put like something like earpiece in my body, and they put for machine. That guy gave me one result, but I wasn't contented. So I went for the one that they will put something like a rub on my chest like this. Then I started rubbing it with like something like this thing. And we're looking at it on the screen. That one now gave a better result. There's nothing wrong with your heart or something. You as a cardiologist, sir, which one is more reliable in this present time? Is it the one, I wouldn't want to say done manually, but the one they use that they put rubber on the body, or the one that they will use roll-on and be checking on this? Can you enter the roll-on?
It's perfume.
Oh, it's okay.
I'm sure doctor understands what you're talking about, so he will do justice to it.
These are really babalawo. Anyway, they're different tests. One is called an electrocardiogram. That's the one you're talking about, rubber, and then it checks the electrical activity of the heart. And that can give you an idea if you've had a heart attack or not.
Okay.
Or it will give you an idea. The other one you're talking about with the roll-on is an echocardiogram.
Echo.
It's an ultrasound of the heart.
Okay.
So that one you can actually see the heart and see the valves and see the muscles move of the heart.
Okay.
All right, so they give you different types of information.
Okay, sir, let me just hold you up a bit. You have Musa from Kaduna.
Musa,
Hello,
good morning.
Musa.
Good morning, Dr. Adeyemi.
Good morning.
Good morning,
yes.
sir.
Okay.
My question is this. I've been on medication for high blood pressure for over 4 years now. But anytime I check, the blood pressure is almost the same, and that's 120, 130 stuff. And I still feel the pains and the money feel. And they will not be able to pinpoint what causes that blood pressure, even though I've regulated my food, I've do exercise and whatsoever. I'm not even part in the first place. So I don't know what is the issue. You cannot easily identify the causes of the problem.
Can you repeat your question, please? He didn't get you.
Pain or
You
something.
say your pain.
That's a big piece.
Okay, let me repeat my question.
Please, yes, come again.
Can you hear me now?
Yes,
Yes,
please.
you can
Go
hear
on.
I say I'm on a drug for almost 4 years now.
Okay.
Okay?
Yes.
But each and every time I check, the average of 120, 130. And I sometimes feel the same thing I normally feel before I went for medical checkup. And I've regulated what I eat and do a lot of exercise, and I'm not even fighting the hospital. So what is the problem? Because they've not been able to pinpoint what is responsible. I don't smoke, I don't drink.
Okay, Musa, just hang up.
Okay. How old are you?
Musa, how old are you?
I'm 38.
38.
Okay, well, so you've been having chest pain, is that what you're saying?
I'm 38.
And you have been having chest pain?
Yes, once in a while.
Okay, once in a while. Well, okay, there are many causes for chest pain, but the important thing is blood pressure will control blood pressure. Blood pressure medicines will control blood pressure, and your blood pressure is under control. But if you have chest pain, there's some other tests that need to be done to find out if the chest pain is your heart or if it's muscular pain, or sometimes it can even be your stomach. So there are many reasons for chest pain, but the important thing is to meet a doctor, probably a cardiologist. There's some tests they will run to see if your chest pain is from your heart or not. So it's very important you check that. Control of blood pressure is critical, which you're doing, but that chest pain, you need to have it checked out to see if, and there's some tests your doctors will know to run.
All right, I'm sure, Musa, I'm sure you got what he said, but then if you're not still clear, maybe you call him after the show. Now, sir, over time, we don't get cases of people, maybe then they jog, then they play football, and then all of a sudden they just slump and die. So is it just possible for the heart to stop beating without giving you some earlier traces? Like,
Yes.
It's just possible?
It is very possible. That's what we call sudden cardiac death.
Okay, sir, we have
Sorry,
somebody from
Joshua.
Ghana.
Joshua, good morning.
Chief, good
How are you there, Joshua?
morning. Fine.
Yes, the doctor is here. Please go ahead with your question.
Doctor, good morning.
Good morning.
Slimmy, good morning.
Morning, dearie.
Please, doctor, is there any combination of food that someone can keep to actually prevent this kind of illness?
Okay, to prevent heart disease.
Diet now.
Any combination of food.
Okay.
Well,
All right, listen up.
I think your diet in Ghana is similar to our own. Important thing is this. Do not eat too many foods that have a lot of fat in them, like beef, meat. The more meat you eat, the higher your chance, the higher your cholesterol will go, and the higher your chances of a heart attack. So reduce meat, reduce fried foods. Simple things. You don't have to do anything complicated. Just reduce fried foods, reduce oil in your food, reduce meat. I'm not saying you shouldn't eat meat, but reduce meat. So some of you, like my friend the other day who bought food from Buka and asked for 8 pieces of meat.
Elodie.
Two is enough. 8 is looking for trouble. And then eat more fruits and vegetables. More fruits and vegetables are very helpful. Those are the main things as far as diet, in a simplistic way. And then if you have high blood pressure, you have diabetes, then you now cut down your salts and this. But remember, salts and fried foods are the biggest no-no.
No.
That's the
Yes,
word.
I like that. It's a no.
Okay, sir, so back to my question.
What was your question?
I
again?
said,
Sudden cardiac death.
yes.
Yes, sudden cardiac death is a whole different spectrum on its own. But the common causes are still high blood pressure, diabetes, high cholesterol. Then there's some people who do not know that they have a problem.
Okay.
And then they are exercising, and then there's lack of blood flow to the heart, and then suddenly they arrest.
Pass out.
Now, if you are near a hospital that can do CPR, there's a good chance you will survive. But that brings me to another topic. It is
We have
important for us.
from
Sorry, sir.
Okay.
Chinonso, good morning.
Hello, good morning.
Good morning, ma.
Good morning.
Good morning.
Speak on, we can hear you. The doctors are here.
Okay.
Reduce your TV volume.
Okay.
Yes.
Okay. Good morning.
Good morning.
Please, I'm so happy with this topic. I'm very, very happy.
Okay.
Please, thank you, doctor, for coming on air to tell us about the stroke of 18. My elder sister has been down since 2016. Hello, can you hear me?
We
Yes.
can hear you.
Okay. My elder sister has been down with stroke for like 3-4 years now, and she has taken medication, yet it's not working very well. She can't talk well, she can't walk well, her 2 legs. Since 2016, I've been carrying her from one place to another and no results. Please, doctor, I want you to help me, please. Sin has been a bone on my neck. What kind of drugs do you advise her to be taking so that she will get well? Sin has been disturbing her. We have been going to churches, going to all kind of hospital. The director said they will go. Within 2 months, the sin will still come back again. Please, doctor, I need your advice. What kind of drug do you think she'll be taking and she'll be better?
Okay, well, it's not really a question of drugs. That is the trouble with a stroke. Once the stroke has happened, there is permanent damage. All right, we don't have drugs now that can fix it. That's why I say it's critical to get to the hospital within an hour or 2. But from 4 years ago, the best chance of recovery, not that all is lost, the best chance of recovery is actually physiotherapy, rehabilitation. That is what works best. It's not usually drugs. You want to control the blood pressure, the diabetes, and all those things to prevent another stroke. But it is important to go into physiotherapy. They will give you the best possible result. Now, unfortunately, some people are not going to improve. But even after 4 years, there can still be improvement if they go into rehab, physical therapy. And that's where the best results will be. But unfortunately, 4 years after, the chances of full recovery are not very good.
Slim.
That is being pragmatic.
Okay, we have Jude from Lagos. So sorry. Hello, Jude.
Good morning.
Good morning, Slimy and Olododo.
Good morning, dear.
Please, I just have a question.
Okay, go on.
There's this friend of mine, and he has a son, a 4-year-old son. The boy is very healthy. Like, he plays a lot. Everybody loves this boy. But all of a sudden, he starts acting out, so they have to take him to the hospital, and they discover that he has a hole in the heart. So, please, I want to know what caused that hole in the heart, because I have kids. So I want to know things I can prevent so that my kids won't have such also, please. And what is in the hole? What is causing that hole itself?
Okay. A hole in the heart is a term that we use to describe many congenital heart problems. It's just a connection between 2 parts of the heart that should not be there. It's just not uncommon. In fact, actually, it's quite common.
Yeah.
Now, the thing is, the children are usually born with that hole in the heart. So when they're born, if a doctor listens to their heart and they do the appropriate test, they should pick it up early. Now, many so-called holes in the heart can be fixed, either surgically, with open heart surgery, or by going, what we do, what my specialty is, going through the arteries and veins and putting a plug in the hole. So it depends on the type of hole. There are certain tests we do, an echocardiogram will be one. And then from that, we can determine if this can be fixed or not. Many of them can be fixed, many. But it's also important to fix them before they become adults, because by then there are more complications. So that kid should go and see a pediatric cardiologist, and then the appropriate diagnosis made and the appropriate treatment carried out.
Okay. Now, let me take you back to cholesterol, for instance. Recently, we started getting information that cholesterol has been knocked out, that cholesterol is no longer a medical risk. A lot of people who are on drugs that reduce cholesterol, statins and all that, they stop dropping their drugs. Can you throw more light on this?
Okay. Yes, I'm glad you brought that up, because I get that WhatsApp message every day. People who now want to start eating shaki, abodi and roundabout and all these things. The fact of it is this. High cholesterol in the diet does not cause trouble. Now, what I mean by high, you have to understand the difference between high cholesterol and high fat, saturated fat. All right, so let me give you an example. Eggs. The yolk's supposed to have high cholesterol. All right, it's high in cholesterol. But that cholesterol, when you eat it, it is not converted to the bad cholesterol that causes the heart attacks and strokes. It's not converted. So taking eggs, lobster, shrimp that are known to have high cholesterol will not cause trouble.
Okay.
So that is what is new. but taking foods high in saturated fat, such as meat pie, chicken pie, fried foods, even fish pie, will be converted to the bad cholesterol and can set you up for a stroke or heart attack. So yes, there's one fact that is for sure. There are more heart attacks in people who stop taking their cholesterol medicines than those who continue. So I can guarantee you, and I can tell you this, most cardiologists are on a cholesterol drug, whether or not their cholesterol is high, because we've seen the effect it has had.
Okay.
It has dramatically cut down the incidence of heart attacks and strokes. I myself am on a cholesterol drug. So please, that WhatsApp message, do not misinterpret it.
Okay.
Yes, eggs.
So
Egg
Let
yolk
me
is
stop
fine.
you a little.
Thank Jacob.
Have Jacob. We'll come back to
Jacob,
that.
good morning. Good morning, Jacob.
Good morning, please.
Good morning, sir.
Good morning.
Good morning. Please
Please
go
go
on.
ahead.
Good morning, please.
The volume on your TV set is
Good
loud.
morning, please.
Good morning,
Reduce
please.
the volume.
Reduce it,
Let me
please.
commend the team there. Let me commend the team for this useful information you are giving us.
Thank you.
Thank you, sir.
I've visually lowered it.
Okay.
Thank you.
Good.
Okay.
You have lowered it too.
Just go on,
Go
Jacob.
on, go on. Don't worry.
All right. The doctor, when you were talking earlier, you spoke about the issue of salt. Then you were mentioning some. Okay, you were mentioning some food items to avoid, like Irish. Are you saying that somebody with BP should avoid Irish potato completely, or what is your advice? And you talk of frying food. Even our stew for rice is fried. What do you think we should be doing on that? And if you are placed on BP drugs, is there a time that you can take and then stop once your BP is normal?
Okay.
Okay, listen up.
Irish potato. I don't remember mentioning Irish potato, but nothing wrong with Irish potatoes. If you have diabetes, you shouldn't take too much by way of potatoes, but that doesn't mean you shouldn't take potatoes at all. All right, so potatoes are healthy foods. The other question I remember now is when you can stop taking your BP meds. The truth of it is the blood pressure medications do not cure high blood pressure. They control it. So most times when you stop, your blood pressure goes up again, and then you put yourself at risk. Now there's some people who were very overweight, did not exercise and ate too much salt, that brought down their blood pressure by going on a diet, exercising, reducing weight, and do not need medications. You can bring your blood pressure down by 15 to 20 points. Let's say 10 to 20 points by just doing the right thing, eating low salt, exercising, I think. So there are many people who can bring it down with a healthy lifestyle. But, so for someone like you, I don't know how big you are, whether you're eating well or not.
You mentioned
But the
fries
truth
too.
is, if your blood pressure is maintained around that 120, 130, that's good. If your blood pressure goes down to below 100, you might be one of those that can reduce your medicines and see what happens. But you've got to do it in line with your doctor. Don't just stop. And there are many of my patients who say they reject the blood pressure and all these things. But I do know this. When I go to church and I talk about blood pressure in church, I notice the pastors and the priests are all taking their medicines. So you that are rejecting it on your own without verification, you are taking a risk. So it's important when you reject, verify that the prayer has been answered in the way you want. But one of the things God gave us was the brain to make these medications and help control the blood pressure. So
Okay, Benji from Ebonyi. Good morning.
Good morning.
Good morning. Good morning, doctor.
Good morning.
Good
dear.
morning.
I have a question for doctor.
Please
Go
go on.
on, he's waiting.
My son is about a year and something now, and he can't walk. So we went to Lagos to one clinic at the Anthony bus stop. They run all the tests, the blood. They directed us from Bagada to go there. So when we went there, they say that everything is nothing wrong with the boy. The boy head is somehow big. They use taste to taste it, but now it's not working. So I want to know whether it's something internally or I don't just understand. So I want doctor to take me with that advice. Let me know what to do.
Well, that's a difficult question for me because that doesn't sound cardiac. I think what you need to do is have a good pediatrician look at the kid and find out. There are many causes for children not walking. There are many. So you just need to see a good pediatric a pediatrician, and they'll be able to tell you quickly what test you need to have done, and then take it from there.
Okay. I'm
Okay.
sure. Did you get him? Sure, he did.
So you were trying to explain the cholesterol, the new information about cholesterol and all that.
Yeah, so cholesterol in the food is not bad, but fat in the food, saturated fat, which is your meats, your fried foods and things. Now the gentleman asked, that was his third question about stew. That stew is oil. Yes, it is oil, but you can reduce the amount of oil. It is very important. Not oil is not cyanide. You can take oil. It's just the amount should be little, and you can tell. When I used to cook, I remember, if you put your soup in the fridge, and in the morning you see 1 inch of frozen oil on top of the food, that's too much oil. All right. So when you put the food in the fridge and there's very little oil on top, you know you're making it with the right amount of oil. So it's not, you can't avoid oil, but just reduce the amount.
Okay, doctor, quickly, I want to ask, the heart, immediately they give birth to us, does the heart also grows with us, or there's a biological
like prostate,
or there's a normal size that the heart should be, and what size? I'm coming, sir. The second one.
Let's take Abdul.
Abdul, good morning.
Hello, good morning.
Good morning, sir.
Good morning.
Please go ahead with your question.
Reduce your volume, your TV volume.
It's I'm reducing the volume.
Okay,
Thank
better.
you, sir. Oh, yeah, talk to our doctor.
Good morning.
Good morning, sir.
Good morning, doctor.
Good morning, sir.
Yeah, my question goes like this. When we were in school, we were taught something about hormone. That when you have much hormone in your body, that there are different types of hormone that secrete from the body. But my question is, I have 2 of my kids that love jumping around, playing too much, like I think jumping too much. So I want to know whether there's one hormone that secrets from their body that makes them to be jumping around like that. I mean, when kids don't, if you ask him sit down, he won't sit. If you ask him do this, he will just want to like be jumping around. I want to know what the cause of that.
Adrenaline.
Well, one important thing is ask your mother if you were jumping around like that as a kid. And then you might have an idea of maybe this is part of you pass it on to them.
Kids are active.
Because what's that saying? They say monkey know the born good.
Sure.
But usually kids are hyperactive. Now sometimes they're overactive. But then you'll have to wait till they get to school and see if they're too active and they're not doing well in school.
Yes, that's when it becomes a problem.
Yes, but generally that's what kids do.
Chief, thank you very much. I have 3 questions in one. Number 1, the use of birth control pills is seen as a risk factor for stroke. Okay? Smoking is another one. Alcohol is another one. I want you to talk on these 3 for the purpose of our viewers at home.
Yeah.
All right. Smoking is a big no-no.
It's true.
Luckily, we don't seem to smoke that much in Nigeria. I don't. Maybe they are closet smokers and hide to smoke, but you don't see them smoking on the street like you see in Europe.
Okay. Yeah.
You know, but smoking is probably the most preventable risk factor. All right. So smoking keeps me in business.
Okay.
So I tell my colleagues who smoke, well, if you want to keep me busy, that's fine. Smoking is a no-no. There's no value from smoking. I used to smoke, and I stopped when I saw my close friend die from lung cancer. So there's nothing good about smoking. It is bad. Cancer, stroke, heart attacks, all. Okay, the second question was birth control pills. There is a small increase in risk of mostly what we call pulmonary embolism, blood clots to the lungs with birth control pills. But it's not high. It is not high. And I wouldn't use that to not use birth control pills. Then the other question was what? Alcohol.
Sorry, sir. We have Chinedu from Anambra.
Okay.
Hello, Chinedu.
Yeah, good morning.
Good morning. My brother, good morning.
Dr. Bat, good morning. Dr. Yemi, good morning.
Good morning, sir.
Everyone.
Question for Dr. Yemi.
Go ahead,
Please,
sir.
Doc.
I'm having blood pressure. So I want to ask, if somebody's blood pressure is 150/95 or 100, is it bad?
It is not good. Your blood pressure should be under 130. That's the new recommendation. We used to say under 140. Now we are saying under 130. So 150 is not good. 150 for a prolonged period of time will set you up, put you at risk for a stroke or heart attack. So you need to bring it down lower than that.
And I'm on medication.
Your medications need to be adjusted to bring it down under control.
Okay, to be adjusted.
Yes. And you need to now look out for your salt intake.
My medication for now is what I take. There's one they call Xarelto. I don't know if you know about Xarelto.
Yes. It's a blood thinner.
Xarelto, 20 grams.
20 milligrams, I hope.
Yeah, 20 milligrams, yes. Then Diovan.
Yes.
160 milligrams.
Yes.
And another one again by Bayer. It's an aspirin anyway. Aspirin. The aspirin is 81 grams.
Okay. Xarelto is not for blood pressure. So there must be a reason your doctor put you on Xarelto. Either you have an irregular heartbeat or something. Yes. It's an important drug.
There's another one again, Atenolol.
Okay. That's for blood pressure and heart rate. So
Spironolactone.
It's like you have the list there.
I think he's just calling the names.
Well, your blood pressure has to come down more. Because it looks like you have more than just blood pressure from your medication. So it is critically important for you for your blood pressure to be under 140. Very, very important. Critically. So you need to see your doctor, adjust your medicines, and cut down your salt. You'll be surprised. Cutting down salt will help you a lot.
Okay,
Thank you very
alcohol,
much.
sir.
Alcohol. There's a lot of controversy over alcohol lately. As far as heart attacks and strokes, a little alcohol does not cause trouble. It can even help.
Sorry, sir. Please.
Ojo from Anambra.
Morning.
Good morning, there.
Anambra, wow.
I'm happy with the program that you guys are doing.
Thank
It's a really
you.
Nice one.
Thank
you very much.
But I have one question, yeah. I noticed that after a long night's rest, when I wake up in the morning, when my BP is supposed to be low, that's when it's going to jump and it's going to just shoot high. I think probably when somebody rests for long, you're supposed to be calm, but my own is different. When I wake up in the morning, the thing is just, very high. And I take my drugs, I take everything, but I don't know why. It is always happening like that when I wake up in the morning.
Okay.
I don't know if the doctors in the house can help me shed more light on this.
Okay. You're not alone.
You're not alone, my brother.
You're not alone. The human body is set up that way. When we wake up, the highest blood pressure is after we've woken up. As soon as we wake up in the morning, the body doesn't seem to like waking up, so we'd rather be sleeping. So once you wake up, your blood pressure goes up. It's normal. So the highest blood pressure in most people is in the morning before they take their medications. But if your blood pressure goes up too high in the morning, then you might need to adjust your medications to cover that morning surge. But it is a usual thing because when you wake up, the adrenaline and all the hormones are activated and your blood pressure goes up.
Sir, I wouldn't let you go without this question. There's this.
He has not answered the alcohol question. No.
I think he cleared it. Said it's
He
not.
was on it.
No, he was on it.
Okay. The alcohol. The bottom line is too much alcohol is bad for your heart and it's bad for your liver, it's bad for everything. Most cardiologists will tell you a glass
of wine
a day is not bad.
He taught us unches.
Unches. All right. But in general, you've got to be careful with alcohol. Too much alcohol will damage your kidney, will damage your liver, will give you risk for cancer and do so many bad things. But a glass or two is okay.
Dr. Adeyemi, is it true medically that there's a particular sex position that if a man, because this is a very, very popular general belief, but I want you to either approve of it or diffuse it once and for all, that there's a particular sex position that if a man practices, can lead to stroke. I wouldn't want to use the particular position.
How will he know now?
He knows he's a man, and he must have read something like that. Okay, let me make it light. Let me make it light, sir. Because of TV, and I know one shop fine. Maybe when a man stands. I'll be here when a man stands. And but on a more serious note, sir, does this have any correlation with stroke? Having sex while standing?
I am not aware of this. This thing you're talking about. I am not aware, but I do know this about sex and stroke. During sex, your blood pressure, heart rate go up. So it is not. It is sometimes it goes up and then you burst a blood vessel and then you get a stroke. Yeah, that usually happens to people whose blood pressure is not well controlled in the first place.
Okay.
So your baseline blood pressure is 180. And during sex, it goes up to 200. And then you can have a stroke. But it's not just sex, any exercise. So if your blood pressure is not controlled, it goes up during exercise and can cause a stroke.
What are the signs? Sorry, sir. Okay, have a question.
Talking about blood thinners, okay? If someone is on it for a prolonged period of time, does it pose any danger?
What do you mean by blood thinners? Aspirin or
yes,
Xarelto?
aspirin. No, aspirin, for instance.
Okay, aspirin. The more and more evidence is coming out now that maybe we're overprescribing aspirin. All right. So if you're not at particularly high risk for a stroke or heart attack, then you shouldn't take aspirin, because there's a risk of bleeding, and you can bleed in the brain, you can bleed in your stomach. So now the recommendation is we give aspirin to only those who are at high risk for a stroke or heart attack. But if your risk is average, we probably recommend you shouldn't be on aspirin because of that risk of bleeding.
Okay, practical question now. I had a patient very recently. The patient came to the hospital, and then I also took the BP. I measured the BP, and it was 130/90. He is a non-hypertensive patient on drugs who takes very good care of. He's very compliant with his medications. So he sat down, and we were gisting for a while.
Sorry, sir.
Okay, we have somebody.
Cindy, good morning.
Good morning, doctor. Good morning, Slimmy.
Good morning, baby.
They call me doctor, you see? The real doctors are here.
Please, go on, my dear, go on.
Don't be confused. No.
Good morning, dear.
Good morning, hello, Dodo.
They just called it. That
I'm a
was it for
veterinary doctor.
My dear, go on, sweet.
Good morning, sir.
Yeah.
Good morning.
Okay, please, I want to ask a question.
All right.
I'm actually in my 20s.
Okay.
But I had a heart attack sometime. Hello?
Yes, where will you go on?
Okay, I had a heart attack sometime. And it was my BP that went high. So I want to know, though it has been treated, is there any assurance that the thing will not come back later in the future?
Okay. Interesting question. It is unusual to have a heart attack at your age. So first, I would like to be sure that the diagnosis is correct. And then two, if you say it was from your blood pressure, then controlling the blood pressure will reduce the chances. But without seeing your records in detail, it's difficult for me to give you an accurate answer. But it's an interesting question, but it's very unusual to have an attack in your 20s. It's unusual. Not impossible. The youngest I've had is 17. So it's not impossible, but first you need to know how much damage was done and then control your risk factors. But you should be followed by a cardiologist for sure.
Okay.
Right. Thank you very much. So back to my question. We took his BP and we were gisting. 5 minutes later, he stood up from a sitting position and then he said that he was feeling somehow. We asked him to sit down again or to lie down, and we took his BP the second time around and it has shot up to 180/100. What could be responsible for such immediate sharp increment? The patient himself felt it and he said he was feeling somehow.
Well, that's a complicated one without running all the tests that we need to run. Just guessing from here. There's some.
No, he's a patient I know very well.
Yeah, I know. But I don't know him so well. Now, you do have surges of blood pressure like that. Anxiety is number one cause. But if the guy is not anxious and things like that, then you start thinking of big big name diseases, something called Pheochromocytoma.
Okay.
Which
He's a 70-something-year-old man.
it's possible, which causes there's a tumor in the adrenal glands which secretes hormones and can make the blood pressure go up and down. Difficult to diagnose, but when you see such in blood pressure, there's some tests you do with the urine and in the blood and CT scan, MRI to find out if there's a tumor in the adrenal glands. So once you take out that tumor, the blood pressure or surges go away. But there could be many other things.
Okay.
Sir, does the heart grows?
Oh, yes, that was your question.
Does the heart grows, and is there anything like overexpansion of the heart? Is it a disease?
Cardiomegaly.
That way, something mega is there.
Sorry,
if
sir.
you not be micro, na mega.
Okay, sir. Let me just add to Wobbs because I know we are actually running out of
Is
time.
it a disease, sir?
Now, is it a disease for him? And then, secondly, all these regular intakes of sleeping drugs, is it a threat to heart attack?
Not necessarily heart attack, but it's a threat to addiction, and addiction has a lot of problems. So sleeping drugs, I try not to prescribe them because they can lead to addiction, and then the complications of addiction now set in. Now, for your heart, as far as it's growing, general rule of thumb is your heart should by the size of your fist.
Yes.
All right. So you notice a
bats.
baby's fist is small. So baby's heart is small. As you grow, the heart grows with you.
Really?
All right. But there is
nice.
a limit to the heart size. So if your heart is too big, we can see it on X-ray, we can see it on ECG, we can see it on echocardiogram. Then we need to look for the cause of the enlarged heart. Number one cause of enlarged heart in our environment is hypertension. So look at your heart as a muscle. If you lift weights all the time, your muscle gets bigger.
Yes.
There's a point where the size of the muscle is now pathologic and it now causes more trouble.
Okay.
So high blood pressure is like trying to lift weights higher than the body was designed to lift.
Okay.
So, is it curable, sir? Does it?
Depends on the cause. But bringing down the blood pressure will stop it from expanding. Usually it's difficult to make it smaller. Sometimes, if you just slightly enlarge, you can bring it down with control of blood pressure. But most times, we put you on medications to prevent the expansion, and in some cases, it comes right down.
All right, we've got to go.
Wow.
Yeah.
Dr. Yemi to go. Dr. Yemi.
So let's get ourselves checked. Of course, they've told us about sorts. We'll see you guys. Thank you so much, Dr. Adeyemi.
Thank you very much for coming. Hopefully, we'll be able to bring you on another day.
I'll see you guys.
Thank you, sir.
Thank you, sir.
I appreciate you coming.
Thank you so much.